Yeah. So good evening, everyone, for again one more session of PCOS course by Orbit Institute of Applied Homeopathy. And though we are closing this program today, though this is the last day of our program, but still there are lots and lots of things we still have to discuss, would like to share with you all. So in today's last session, we are going to first explain about and give you more information about that along with homeopathy. It's not only the medicine, sometimes we need to take help from other things like diet management, like exercises, and there are so many things which can help us in proper management of the cases of PCOS. So today in the session, what we have is the proper management, proper counseling, proper things that should be told to the patient, not only along with the medicine, but everything from first to last, they should be explained that how they can take care of themselves and how they can get rid of this PCOS issue permanently. So today we have our speaker, Dr. Sakshi Gupta. Most of us know her because she's an incredible learned homeopath. She is involved in a lot of counseling sessions. She's a counseling psychologist. She has been associated with Orbit Clinic since 2019. And she has been practicing since 2012. She graduated, or she has done her BHMS from Nehru Homeopathic Medical College from Delhi, and she got her master's in clinical psychology from a institute in Delhi. So by her rich experience and by her rich knowledge about these cases in counseling, we would like to take her knowledge benefit to everyone whosoever is there in the course, that they can understand, and we also will benefit a lot from this session. So Dr. Sakshi Gupta, over to you. Please go ahead.
Thank you so much, ma'am, for such an elaborate introduction. Good evening, dear learners. Today is the last day of the theory class, and we have almost covered everything about PCOS by the learned faculty of the institute. So today I'll be basically discussing the general management tips, which most already have known by now, as we already know what are the etiologies, predisposing factors, and aggravating factors of PCOS. We all know that what all advices or suggestions we need to give to our patients, along with a well-selected remedy, so that we have the expected results of our treatment. So to start with, the next slide. Next slide. Next, yes, sir. So to start with, let's discuss with certain management goals in cases of PCOS in particular. Like what are the aims we need to set when we are treating the case of PCOS? It basically should provide care which is individualized to patient's needs, customized to patient's requirements. The management, it should help reduce the symptoms the patient is suffering from. It should help improve the psychological and emotional health which the patient might be encountering with. The management should be able to prevent the progression and the complications of the disease, and it should also help in assisting with fertility and improving pregnancy outcomes whenever as per the case, if it is required. So basically the keys to achieve good management, it includes, like on the part of the patient, they should have a good understanding about PCOS. Like whatever we have learned till now, it always helps if we educate the patient about the disease. It should be they should be aware about the healthy lifestyle routines. A daily routine regime should be there, accompanying with holistic medical therapy. Now, if we are talking about these three key features about the good management, about the PCOS, the details of the PCOS we have already known by now. We have already known what are the medical therapies homeopathy, basically what treatment and how do we proceed with the medicines. So the one key feature which is left is healthy lifestyle and the changes which we require to suggest our patients to inculcate in their daily lifestyle, so that they can help the medicines to get the better treatment. Okay, so next slide. So herein we'll first learn about exercises, the lifestyle modification, whatever the patient needs to acquire in their daily lifestyle. First of all is exercise, out of which I'll say that the first important thing is they should inculcate any of the exercise, any of the regular exercises seem to be effective in cases of PCOS. The first thing we can suggest to a patient is that they can include any physical activity for at least 30 minutes a day, and which needs to be increased gradually, but 30 minutes basically is required for minimum. If they if they have certain issues, they do not have time, they can just break it up to 10 to 15 minute session, but that needs to be frequently repeated in a day, which can include structured or even incidental exercises like household chores is there, or they are working, they are following some regular exercise regime, they can do that. So here we will see that research has shown that any type of regular exercise is effective in improving PCOS symptoms. And what are the symptoms in which the patient is able to experience improvement is the androgen levels are reduced. Exercise helps in improving the insulin resistance. It helps to regulate the menstrual cycles. It helps induce ovulation. It helps improves fertility, increases energy levels, improves self-esteem, and also it helps to reduce anxiety and depression. Now, how do exercises help in improving anxiety and depression? Like, there's a neurotransmitter, basically a mood regulating hormone, serotonin. It has a it has an immense improvement in anxiety and depression cases because of that hormone. So that is basically released when the person is physically active. So that helps in reducing anxiety, stress, and depression. So next slide. So here we can see, although reduction in the weight by only 5 to 10% has been shown to restore ovulation and increase insulin sensitivity in obese or anovulatory women. Like, if the patient gets physically active to certain extent and is able to reduce her weight by even 5 to 10%, there will be a marked improvement. But even if the patient is unable to reduce weight, but she is physically active, whatever is required according to her age and weight, then also in certain researches improvement has been shown. So next slide. Okay, if we talk about females who wish to prevent weight, like at present they are not overweight and they wish to prevent gain of weight or maintain their health, we would suggest that females who adults, like who are in the age group above 18, so what they can do is we can suggest them to have moderate intensity physical activity for at least 150 minutes a week or 75 minutes per week of vigorous exercise. Like, if he's doing moderate activities, 150 minutes a week is required minimum. And if she's indulged in some vigorous activity, then 75 minutes per week will equally help her. And in adolescents, like we commonly see very young girls these days suffering from PCOS. So when we have to suggest them, then moderate to vigorous activity for at least 60 minutes or more per day, including muscle strengthening activities at least 3 times a week. Like, if they do this at least 3 times a week, that would be really helpful for them. And if we talk about moderate exercises, like what do we suggest to a patient who's having who will be doing moderate exercises, we can suggest them to have a brisk walk, or gardening sort of things. Cycling can be there, like not a very high speed. Some sort of aerobics activities are there, like moderate dancing. These can be suggested in moderate intensity exercises. And when we go for vigorous ones, Then regulated sports, muscle strengthening activities, and standardized basically exercises, they are to be done by the patient, like speed walking, jogging can be there, like mild running can be there. These sort of activities we can suggest them. Swimming is very good for them, and dancing basically, like daily activity, they can indulge in these sort of activities if they are to do vigorous activities. So next thing. So next thing. And here, for women who are aiming to lose a moderate amount of weight without dieting, like the females who are already overweight and they wish to, reduce their weight, prevent further weight gain, or achieve greater health benefits, then we'll have to suggest them a minimum of 250 minutes of moderate intensity activity or vigorous activity. If they can do, then 150 minutes a week can help. And muscle strengthening activity on 2 non-consecutive days of the week can be suggested to these patients. Overall, like they should aim for around 30 minutes per day minimum. Of this, 90 minutes per week should be some aerobic sort of activity, like running can be there, biking or fast walking they can inculcate in their daily routine at a moderate or high intensity for the best clinical outcomes for that particular patient. So next slide. Okay, so after exercises, the patient needs to, make certain changes in their daily diet regime too. So basically, to lose excessive weight, the patient need not follow any specific diet, like various diet forms we are, we get to know these days. They need not follow those hectic diet schedules, but reducing calorie intake and having, nutritional balanced diet will help them a lot. It would be a successful approach in managing the cases of PCOS, because what has been seen that the hormonal changes which occur in PCOS, they might lead to lead to that feeling in the patient that they are not full after eating as much as the food. So that basically leads to overeating in them. So that is again, like when you do not know that okay, I have eaten this much food and now I'm feeling full, so they just get accustomed to eating more and more food. So basically they need to they need to add small amount of meals, and they can add like they can have it frequently. So basically, like they can add vegetables, salads and fruits, so that the high fiber content is there and balance of protein along with that is maintained. Along with vegetable, fruits and salad, like plenty of water intake can be there. And again eating regularly but small frequent meals, that concept, if it is followed along with healthy balanced diet, it really helps a lot in for the patient in being healthy and reducing the weight, because it again helps to stabilize the insulin levels, as we see that insulin insensitivity is there, which helps to manage the weight. Which basically, it should be like, in simple words we can explain to the patient, like there should be 3 major meals, like they can have breakfast, lunch in afternoon and dinner at the night, and 2 small meals in between these 3 major meals. So next slide. Okay, so basically, like some amount of fats are also required, but they should be limited in content, like saturated fats. But instead of that extra fat, we can suggest the patient to use virgin olive oil, avocados, nuts and seeds, but they should be healthy enough to add that healthy fat content in their diet regime. And apart from these, a few researchers have showed that adequate intake of omega-3, vitamin D, calcium, magnesium, and chromium has been very useful. Whereas we can see that omega-3, it helps in lowering the levels of testosterone. It is really helpful in that, like the androgen levels are very high in PCOS cases. So it basically helps to reduce that. Vitamin D and calcium, they basically helps to regulate the menstrual irregularities the patient is suffering from. And magnesium and chromium, they help to lower down the insulin resistance. So they have been found to be really helpful for these patients who are suffering from PCOS. So if they include these things in their diet, that would be additionally helpful. And again, that for any other disease, it has been really well understood that the substance abuse like tobacco or alcohol, it should be in minimal. If the patient can stop that, that would be really helpful, but otherwise it should be absolutely minimal intake. So next slide. Okay, so like in the lifestyle modifications, if we have till now learned about the exercises which we can suggest to the patients, the dietary intake we can suggest to the patient, and apart from this, we can also see among these patients that they are undergoing certain emotional changes. Like they might show it up to you in the initial visits, or they might not. That we as doctors, we need to elicit these changes. So what can be these? Basically, that the patient might be anxious because of the irregular periods. She might be fearful that she might not be able to conceive after marriage, or because of the physical appearance, the changes in physical appearance, the patient might be seen depressed. So we need to address these conditions too, because we as homeopaths, we take into consideration all the complaints the patient is suffering from, be it any pathology. We do consider the mental symptoms too. So these basically three things are very commonly seen in the patients who are suffering from PCOS. So how do we basically address these sort of things? So next slide. So first of all, we need to start with educating the patient. The patient, they are unaware, or they have, heard various things about PCOS, or they have read it over internet and seen various videos on YouTube. So they have that misleading information with them. So basically, what information a doctor can provide, that cannot be, provided by any other source. So they have already various misconceptions in their mind, which leads to again fear and anxiety. So the first thing we need to to intervene here is to educate the patient with the correct information about PCOS. And like after explaining that, okay, this is PCOS, and if you do not take treatment, then what can happen? But if you take regular treatment, we can address these complaints the best, and we can delay or prevent the complications further. So for that, treatment is basically required. We need to encourage them to have to just provide regular follow-ups, and they should visit the clinic frequently as and when required. We can again tell them that, okay, this PCOS is not it is it is a very common complaint these days. It is sometimes difficult to deal with, but it is absolutely not incurable. We can definitely fight it back with medicines, with your own self motivation and the lifestyle changes which we have discussed. So this is basically a syndrome. We do not we just cannot treat it with just one simple thing. It is basically has become a lifestyle thing. So we need to inculcate all these changes in our daily routine. Then only we can address this condition. And yes, we can do that finally with, if we take into consideration all these things, because positive results, they do come. They positive results when the patient is able to experience it in herself, and she's able to realize that, okay, some changes are coming. So that again encourages the patient to stick to the treatment. So that is again, although it's our thing, but we need to keep motivating the patient, keep encouraging the patient that, okay, this is not something which is life threatening, or it will help, it will have any future consequences like difficulty in conception and all. These all things can be addressed if the proper regime is followed. And again, one thing along with all these interventions we can suggest is, like when we counsel our patients, these are certain basic things, like when we ask them to inculcate certain things in their lifestyle to relax their mind basically. So yoga and meditation, we all know that, okay, like if someone who's not suffering from any psychological issue, they can also do these things, and people are really accepting these things. They help us to calm our minds. Apart from these, for a patient, we suggest deep breathing exercises, which is it does not require that, okay, you need to sit at this particular place and this should be the basic position. No, nothing. The patient just has to take slow deep breaths. Like you can suggest that like the way you are sniffing a very good odor, yeah, like, some good fragrance is there, and the way we breathe it in. So that way, that slow and rapid, like slow and deep inhalations basically, and similarly slow and deep exhalations, so that really help. Like it won't be it won't be helpful, it might not be helpful in 1 or 2 days, or but it will definitely have results in future consequences. So the patient should be, they can be suggested to do these things if we come to know that okay, this particular patient is having certain sort of anxieties, or they are undergoing any sort of stress. So it really helps a lot in these cases. And one thing is JPMR. It is basically the counselors use to help patients relax themselves both physically and mentally. The full form of JPMR is Jacobson's progressive muscular relaxation. If you Google it, you can also find it there. It basically it targets each and every single muscle of the body. There's a particular method of doing that. It needs around 40 to 45 minutes for a minimum. The counselors, they usually train the patient, when they have them in their clinic, they train them then and there, and then later on when the patient gets trained in that, they can do that on their own in their, like, at their homes even. So Jacobson progressive muscular relaxation, it basically aims to relax our muscles, like each and every body muscle is relaxed. When the body is relaxed, the ultimately the mind also, it sometimes, it just calms down. So we, like, when the anxiety is on its, peak, when the stress is on its peak, a body also, it feels, stiff, and like it is under some sort of tension. So this technique basically helps those patients to get themselves relaxed and feel better. So these conditions, we can suggest these patients to uh, practice them and inculcate in their daily lifestyles. So next slide. Okay, so one of the management techniques is preventing complications too. When we are managing a case, be it any disease, we need to take into consideration that the complications are prevented, or at least they are delayed, or at least they are, they are stopped at that particular stage. They do not progress further. So when we talk about PCOS, the patient needs to go for routine screening for diabetes. As we all know now that the incidence of diabetes in cases of PCOS is very much high. So apart from diabetes, there are higher risk of increased, like, dyslipidemia, increased blood pressures can be there, and screening of coronary artery disease and obstructive sleep apnea. These complaints, they develop eventually when when the condition is not, the PCOS is not, managed adequately. So these might be experienced by some of the patients, not all of them, in the near future. So these things need to be addressed very well. So apart from them are serum ferritin levels and vitamin D levels. These things need to be, these are some of the things I would say that need to be screened on a regular basis for the people who are suffering from PCOS. So this is it. I guess I have tried to just crisp it up, and like in a short way, the management techniques we can use for the patient along with our treatment. So these were it. Thank you so much.
Thank you, Dr. Sakshi.
Thank you, man.
Thank you for such a nice way to handle the cases. I think everyone would have learned something or the other, and it will definitely help everyone in managing the cases. And there were very few points. Many of the few points were there which I was also not aware of. Thanks a lot for enlightening this and giving more knowledge about it. So now, Dr. Deepak, what do we have in the bag now?
We have many things to do. So I think I request every faculty member or to share a 1 or 2 points to there, or if anyone have any questions, regarding the courses or regarding the PCOS, and they can share first because we have the cases, but I should know if anyone are not understanding or have any questions, then we will go according to that.
Fine. So I would like to say, do we have those questions which we plan to do?
Yes.
Yeah, there were few important things which we all come across with our daily practice, not only with the cases of PCOS, with many other cases. There are few practical difficulties which every doctor comes across. So we have few things, few of our major practical difficulties which we all have faced. Let's see them as a question wise. Dr. Deepak, can you run those slides? Fine. So this, as you can see, it's an open session. Question can be asked by anyone, but since we are having the opportunity, so we will show some of the slides in which some questions are there. Before any of my faculty members who are there, who have done their best jobs in describing each and every part given to them, before that, I would like the audience here to answer that. So first thing, Dr. Deepak, can you just show the next slide? Fine. So one of the things I'm just giving as a question to everyone to answer. A patient comes with a confirmed pathology and a confirmed case, symptomatic symptoms of PCOS. So it was a confirmed case of PCOS. We found the best medicine after exhaustive case study. The doctor did the best job. Within 6 months, the symptoms of the patients became fine. Means like she was getting regular periods, the weight was reducing, hair fall was better, and many other things which she was complaining of were very much under control. So it was advised, let's have a ultrasound report check done again, just to see how the changes have happened. But to the surprise was 8 months back, before we did this ultrasound report, the case came back with almost a similar kind of pathological study. Ovary size was same, the number of cysts were shown as same. So what could be the reason for that? Why would have that happened? That the ultrasound report has not any changes, though symptomatically the patient was very much better. So first of all, I want everyone who is there, except my faculty members, to answer this, come forward and give their opinions, and then I would request one of my faculty member to answer the same. Anyone?
Ma'am, I think like if the ovary size is same, but same in this case, I think those symptoms are reducing.
Yes, symptoms are reducing, no doubt. But why pathologically no changes have been seen in the ovary? Why ultrasound has not shown any changes? Similar to that, quite similar to what the first finding was. What could
Ma'am, I think so. This is related with the Kent's 12 observation name. There is some observation name, I think so, 3 or 2. Like the pathology is the same, and but the symptoms are reducing. So case the homeopathic remedy selected was superficially acting. Uh,
Yeah, I think you're very close to the answer. Yes, anyone else would like to say? Okay. Richard, can you explain?
Well, it was thought that the process is in reverse and it'll take slow time following Aaron's law. So the disappearance of the symptoms will go gradually in the order of reverse of apparent appearance.
Okay, so to say that the progress is happening, but it's very slow.
That's right.
Okay, fine. Okay, anyone else would like to give the opinion? No one else? Okay, Dr. Sakshi Garg has said that the remedy that was given acts superficially only. Fine. So, Dr. Shweta is there. Maintaining cause may be persisting. Okay, good. Do we have Dr. Shweta here? I think she
I
is.
think she's not there.
She's not there. Fine. Okay, so Dr. Deepak, would you like to answer then?
Yes, the answer is very simple that we are giving the palliative treatment as the Dr. Akansha said in fact.
Yes, Dr. Akanksha Chauhan just now said the same thing. The
Dr.
correct word she has used.
Yeah, Dr. Abhishek Duggal was also good. We are
Yeah.
close to the remedy, but the remedy are acting only the superficially, and the symptoms are going, but the pathology is same because we are not working on the pathology. You are just taking the symptoms as patient told, and you do not think about the pathology. Like that, we are considering that 20 symptoms the patient is was given to us, and we repertorize it. But behind this, we are not going to take the deep mathematica like many of the homeopathic physicians are doing. They doing repertorize in a software, and the 20 or 30 remedies are coming up, but they choose the first or second remedy by thinking that these are the best remedy. So dear homeopaths, this is not true. You should compare the medicine, the medicinal symptom and the patient symptom, and should match the pathology and the level of the pathology. So-called, you can call as a miasm, or you can call as a deep history. So your medicine was good, but it was not very perfect simillimum. So go for the simillimum, or the second option is to use the intercurrent remedies like nosode or sarcodes or any other remedy that can be a follow well of the remedy you already gave. Yes, Richard, you can repertorize again, but you choose the remedy which is very best suitable. This is not only from the first or second or third rank, it may be from the 20th rank. So choose the remedy which is very simillimum to the patient.
One.
This is from my side, Dr.
Yeah, fine. It was here. So basically, we have to treat the patient, but the treatment given was a quite a palliative one. So we have to rethink once we get this ultrasonographic reporting that our medicine is just working superficially. We are not going in the depth. We have to choose some intercurrent medicines. Not only just the repetrization will work, we have to do a deep study considering pathology as the main symptom. Fine. Go to the next slide, Dr. Deepak. Fine. Next question or next, sometimes we get this difficulty. A patient came with a symptom of no menstrual cycle since past 4-5 months. We took the proper history. We got the best medicine for that case. And the period started for her. But what happened was, cycle which start had been prolonged. It has been there for almost since 15 days. What should be our approach? So first of all, again, I want all the people present here, this one of my faculty members to answer this.
Here in this case, I think so. Like if the menses are not there for 4 to 5 months, after giving the medicine, it started. There is shredding of the lining, and uh, so we should, I think, give certain medicines for. We should, I think so. We should give either SL, or we should wait or give the medicine which covers the weakness of the patient, and or wait and watch. This is the thing. Like, if there are heavy flow, we have to give certain medicine like China or Ferromet. Yes, it's my thinking here.
Okay, so basically you mean to say we should wait and see when the bleeding stops, and if
Yes.
in case, even if it's
Mhm.
prolonging little more, we should not disturb the case, and we should not
We should not disturb the case, but we
but
can certain give the weakness if there is patient is complaining of more weakness, because
Mhm.
if there is, if the cycle is prolonged, the patient can be weak. We can think of that only point, nothing else, or कोई remedy नहीं देना.
Okay, we should not think of giving anything to stop the bleeding, right? That's what your opinion is.
Yes, yes, ma'am. Yes.
Okay, fine. Anyone else? Good try, Dr. Abhishek. Okay, Dr. Sakshi has said that first we should give medicine to stop the bleeding so that patient should not go into shock. Okay, and Dr. Akanksha Chauhan's opinion is we should not disturb the case. After some time, menses will automatically stop. Fine. So now, since I have got few opinions from the people, okay, Dr. Priyanka says we must consider about flow. If it's heavy, profuse, then we must antidote the effect of previous medicine. Okay, fine. So now, since our okay, from Richard, we could retake the case and give the new appropriate remedy. That means we should give medicine to stop, basically, Richard, right? Okay, so now I want my faculty member, Dr. Ashish Goyal, because he had given us so much knowledge about medicines. So let us see what is his opinion, what would his approach would be according to his experience. Dr. Ashish?
Actually, this is the good question, and most of the time we see these conditions, and I'm seeing the answers given by everyone, and it is just nearer to the answers of everybody, and actually it depends on the conditions and the case. First of all, we should know that which medicine we have given during the first prescription. Either it is on the basis of the particular symptoms or on the basis of the general symptoms. Second thing, which is the most important thing, I don't remember that name, which I think Dr. Sakshi told that first of all we should stop that menses, and then otherwise she will go to the shop. It is right. Actually, first of all, the basic thing is that we should take the complete case on that time and take all the vitals, that she is in the normal conditions, all vitals are normal, how much trouble she has. So I have already told some points in the starting, that location, sensation, characters, and modalities. So during these conditions, we have need of the such points. You have to just take the complete case according to these points, that is there any pain, is there any, and the main thing is the what is the character of the menses, that is the dark clotted or just flow is the
Dr. Deepak, are you able
No,
to hear?
network.
Let me add one thing.
Yeah. Yeah,
please.
Dr. Manisha, please go ahead.
Ma'am, this is the condition in which there is a prolonged bleeding. It might be reason that because of an ovulation, there is a estrogenic phase. So there is a proliferative phase. The endometrial lining is increased so much because she had a amenorrhea for 4 to 5 months. So when the menses will appear, it is very clear that all these layer will shed out. So menses will prolong. It is due to the excessive layer formed during an ovulatory cycle. So, considering all the vitals of the patient, plus you have to counsel the patient that this is the normal, because when the period was not coming at that time, because of excess androgen, which causes increased layer of the endometrial lining, which will shed, and it would take some time. But by meanwhile this, you have to consider all the vitals, that patient will not go in shock or other complication will not occur. If it is a normal patient will not feeling any worse, it may be a good sign, prolonged bleeding, because it will finally lead to the shedding of all the layer. And then later on, if still it persists, then you have to think what was wrong with the medicine or what management we could do there.
Yeah, I think I agree with all of you. So basically, according to me, if I would have got the case, in fact, I get, that's why the question came. So we should see basically the vitals of the patient. If the vitals of the patients are under control, there is no weakness, there is no anemic situation, there is no giddiness, and all these symptoms are not appearing, then we should not disturb the case, let it go. If in case any of the vitals are disturbed, then based on the vitals which are disturbed, we should give the medicine which is required at that time. Fine. Next question, Dr. Deepak. Fine. This is also one of a very good question. Is ultrasonographic findings the only and the best way of knowing the PCOS? Do we have any other thing? Here it's written USD, sorry. So if is only the ultrasonographic finding the only and the best way of deciding whether a person is having PCOS or not, or are there any other, you can say, investigations through which this could be found? Which is the best method to find the PCOS case? Should we go with only the USD findings, or some other test we should go for? Yes, anyone from the audience? Okay, so Dr. Priyanka says no, ultrasonographic according to her is the best. Okay, Dr. Priyanka says MRI. Okay. Fine. Anyone else? Dr. Akanksha says TVUS done in these cases. But the only thing is, in India, especially in unmarried girls, it's not allowed. Assessing settings, prostadial. Okay, MRI TVS. No, not only depend on ultrasonography, V levels, hormonal assay also. Okay, so I have so many answers in this. I would like to see what our faculty member has to say for this. So since Dr. Manisha had taken this lecture, so I would like to like her only to answer this question. Dr. Manisha, what's your opinion?
Ma'am, according to me, though there is a lots of advent of the technology, but still there is no single test on which we finally based on the PCOS diagnosis, because still we depend upon the physical examination, ultrasonographic test, and the blood test, which together considered for the diagnosis of PCOS. Now coming to the USG, with the advent of the USG, numerous parameter has been proposed till now to define the PCOS, but still there is a no consensus as to respective diagnostic value. So what will be the diagnostic value which has to be seen in the ultrasound so as to consider it to PCOS? It is still questionable. And though TVS is most common or most gold standard technology for the ovarian images, but still there are various criteria to detect PCOS. Like as we discussed in the class, that the Rotterdam criteria was given, in which out of 3, if any 2 of them is present, you can diagnose the disease as PCOS. Like if there is a irregular menses, oligomenorrhea. Secondly, if there is a changes in ultrasonography, like there is a more than 12 follicles in a ovary, or there is a more than 10 ml volume of the ovary, or there is a more than 2 to 9 size of the follicles present in the ovary, that is that there is a polycystic or multiple follicles are in the ovary, then out of 3, if any 2 of them is present, it doesn't necessarily ultrasound is one of the criteria. If any of the 2, like if there is irregular menses, or patient will have a history or give the signs of androgen axis, like acne, all the androgen axis symptoms and signs which we discussed earlier, if that was present, it is sufficient to diagnose the PCOS. But because this in ultrasound, the appearance of the ovary is polycystic or multifollicular, which is very common in women which don't have a PCOS, because in that case, even healthy women have a features of PCOS in USG pattern. So still there is its criteria is questionable, but we depend on ultrasound. On that cases, if out of 3, if ultrasoundic changes are present, but before that, PCOS is mainly a exclusive criteria, but you have to exclude other criteria of the features which are similar presentation like PCOS, like thyroid, prolactin. You have to exclude it, not only based on the USG for this diagnosis. And in future might be various new technology will come and so as to detect this PCOS, but still this USG main reason or main test for the PCOS is still controversial. But we usually rely on it. If all the features of the Rotterdam criteria are present, then we can definitely use USG as one of the criteria.
Fine. Thank you, Dr. Manisha, for such a detailed answer. Yeah, next one, Dr. Deepak. Are there any natural things along with medicines that should be administered which might help in the case? Now, this question, no one else, but Dr. Sakshi would be the best one to answer. Dr. Sakshi Gupta.
Yes, ma'am. Actually, the things which we have discussed, discussed right now, along with the medicines, the natural things like good dietary management is basically very much required. Vitamin D, rich foods, magnesium, chromium, these things that we discussed earlier. So these things, which basically they have a very good action upon the action, upon the symptoms of PCOS. And if we talk about the sources of these nutrients, we can say that omega-3 is found in good amounts in fishes, nuts, and seeds, certain plant oils, eggs, milk, and yogurt, we can say. And vitamin D and calcium, we all know that vitamin D is synthesized from sunlight, and to support its synthesis, we can have certain calcium-rich things like egg yolk, cheese, beef, or mushrooms. For magnesium, we can say that the patient can have nuts or seeds, cereals, black beans are there, yogurt, banana, milk, and certain fruits. They are also rich in magnesium. And if we talk about chromium, which helps to lowers the insulin resistance, it can be found in potatoes, whole grains, in certain seafoods, and in non-veg. So these things, like pertaining to the patient is whether vegetarian or non-vegetarian, these things can help along with the treatment. Basically, to have along with the treatment, it helps a lot.
Okay. Thank you, Dr. Sakshi. Fine. Next one, Dr. Deepak.
I think we should know about the things from Dr. Sharma because she wrote yes, of course. So what she have in their mind, please.
Okay, I'm sorry, I missed that message. Yes, Dr. Akanksha, what do you have to say? Please tell me.
Good evening, all of you.
Good evening.
Actually, as I learned from PCOS session, there is 4 ways to conduct a case that after medicine we can treat diet maintenance and exercise, and counseling of the patient is also important in the treating the PCOS cases. So I think they are natural ways. And as Dr. Sakshi says that for vitamin D is very important for the PCOS cases, and omega-3 and such every things, natural things which we used in treating management of the PCOS.
Fine. Thank you, Dr.
Thank you, Dr. Akansha. Dr. 1 minute. Dr. Akansha, you said the vitamin D is very important for PCOS patients.
Yes, sir.
Except Dr. Manisha Yadav, because she is a pathologist in homeopathy. So
yes,
what is actually the role of vitamin D in ovary? What
sir,
actually
so vitamin D strength our bones, and vitamin D strength the body and our soul and mind.
what is the impact of vitamin D on ovary? Because we are talking about the PCOS. So what's the role? Ovary is not a bone.
Yes, sir.
Ovary
Yes, sir.
is not connected.
Yes, sir. Yes, sir.
Helps in
Sir, it's helps in lower the androgens levels.
Okay, good.
Yes, sir.
And
And maybe it's helpful in improved insulin resistance.
good.
Yes, sir.
Now we have to listen from Dr. Manisha.
Yes, sir. Vitamin D has a physiological role in the reproduction, especially ovarian follicular development depends on the vitamin D. We require vitamin D for the follicular development and luteinization. As in PCOS, there is no ovulation, there is no formation of the corpus luteum. So luteinization is required for the regular menstrual cycle, and vitamin D plays important role in it. And it also have altering AMH. AMH is anti-Mullerian hormone, which increased in PCOS because there are number of small follicles and they start releasing lots of AMH. And you have to neutralize this AMH, which is done through the vitamin D. So we major
ओ शिट यार, यार ये तो कुछ हो भी नहीं सकता। अरे यार, शिट यार, कितना ट्रेनिंग खराब है। करना कर लेंगे, मैंने इसको पहुंच ही नहीं आया। Yes, Dr. Sorry.
Okay, I have posted the link for both the puzzles as well as the crossword. I'm not very sure. Richard can access them, but I'm not very sure about others. Dr. Manisha, are you able to access them? Can you just try to open them?
Okay, ma'am, let me try.
Dr. Deepak, can you share the link if you have that?
Which link, Dr.
Puzzle and the crossword.
Yes, I already sent it to Shanvi. I'm sending it. I'm sending it.
We didn't get anything from Dr. Shanvi.
Yes, this is for crossword.
Please let us know once you all have submitted your answers.
And there is difficulty in selecting the answer. उसमें सर दीपक सर चेक बॉक्सेस ही ऐसे आ रहा है कुछ, like if first any option is fourth or so there is no tick, there is difficulty in clicking or ticking the thing. Shall I reload the form?
Yes, Dr. Abhishek, the link is working here. Everything is good. I checked twice. Is the difficulties to open the link is only at one side, or everyone is facing the problem? Sakshi ji,
हाँ जी डॉक्टर दीपक।
is there only puzzle is on there, or anything else you want to share? Because the puzzle data we will get in next 30 to 40 minutes, so
Okay,
that
fine.
everyone can do this work after the meeting also. No worry about it.
Okay, so this link will be available for next 30 minutes for everyone. So you can take your time and finish this and submit it. The results will be announced to everyone individually, and we will be giving the certificates to all the participants, whosoever was there. We'll be sending that by post, except for those people who are in India. They'll be getting an e-certificate. And for others, very fast, once we have generated the result of the quiz and everything we have done, we will be sending and delivering the certificate for the course. And I would like all of you to give little feedback to us so that we can improvise ourselves for the upcoming programs which we are planning. And I would be happy if you all join for our next course. The details of our other courses which we are launching soon will be shared to everyone whosoever was present in this course. Yeah.
I shared the feedback form.
Yes, and there's a feedback form as well. So you all can share your feedback. It will help us improvise for the next upcoming courses. Fine. So should we end now, Dr. Deepak? Anything else you have to say?
Yes, I think everyone should be there, and you should consider about the PCOS is not actually a disease of ovary only. The name is belonging to the ovary, but there is not we cannot blame the ovary only. This is a big thing. अगर हम लोग सिर्फ पीसीओएस की बात कर रहे हैं ना, तो हम लोगों को ये जरूर ध्यान रखना है कि सिर्फ पीसीओडी के साथ
मैं
साथ
अभी बंद कर लेता हूँ, मैं यहीं बैठा हूँ।
दिक्कतें आई और ओवरी ने अपने आप काम करना बंद कर दिया। उस अप्रोच को जरूर कंसीडर करो, और ये जरूर ध्यान रखो कि जो मैंने एक सिम्टम बताया था, सिम्टम है इग्नोरेंस वाला। ये जनरली फेजेस में से शुरू होती है जहाँ से इग्नोरेंस शुरू होती है। इग्नोरेंस किसी भी लेवल पे हो सकती है, चाहे वो फैमिलीज के मैटर को लेकर के हैं, चाहे वो फ्रेंड्स के मैटर को लेकर के हैं, चाहे वो हस्बैंड के मैटर को लेकर के हैं। और जनरली पीसीओएस के लिए अगर आपको एक सच्चाई बताऊं, मतलब क्योंकि मैं चाहता हूं कि आप लोग वो चीज़ें पढ़ो ताकि आप सब लोगों को बहुत सारी कुछ ऐसी नॉलेज मिले जिससे जो बुक्स में नहीं होती। अगर हम सिर्फ पीसीओएस को एक बहुत ध्यान से समझेंगे तो ये इवोल्यूशन का प्रोसेस है। लाइक कि आप लोग फेस कर रहे होंगे, यहाँ पे बहुत सारे हेयर फॉलिंग के केसेस आप देखते होंगे। मतलब पूरे वर्ल्ड में इस समय हेयर फॉलिंग एक ऐसा सब्जेक्ट हो गया है जिसमें सब लोग काम कर रहे हैं, लेकिन सब लोगों को ये सोचना चाहिए कि जो हेयर फॉलिंग है ये इवोल्यूशन का प्रोसेस है। जो काम हेयर्स का होता था वो आजकल नहीं होता। हेयर का काम था टेम्परेचर को कंट्रोल करना, लेकिन टेम्परेचर कंट्रोल करने के लिए अब हमारे पास एसी हैं, हमारे पास हीटर हैं, या हमारे पास बहुत सारे इक्विपमेंट्स हैं जो हमारा टेम्परेचर कंट्रोल करते हैं। तो जो भी हेयर्स हैं इस समय हमारे सिर्फ कॉस्मेटिक पर्पज के लिए रह गए हैं। कॉस्मेटिक पर्पज के अलावा इस समय हेयर का कोई काम नहीं। तो कुछ टाइम बाद हो सकता है कि बिना बालों के भी लोग पैदा होंगे। सेम इज ए पीसीओएस। आप देखेंगे कि जो इनफर्टिलिटी का रेट है वो इतना ज़्यादा बढ़ता चला जा रहा है, और अब लोगों ने सब कुछ प्लान करना शुरू कर दिया है। अगर आप यहाँ पे सब लोग जो इंडिया से हैं, तो आप लोगों ने एक बहुत कॉमन सी जरूर बात सुनी होगी कि जो बेटियां हैं, जो लड़कियां हैं, उनकी शादी जल्दी हो जानी चाहिए। सब लोग एग्री करते हैं? ये अब से नहीं, बहुत सालों से ये ऐसा आता रहा है। तो हमारे जितने भी एमिनेंट लोग थे, जो हमारे पूर्वज थे, वो ये जानते थे कि कुछ तो गड़बड़ हो जाता है अगर टाइम से शादी नहीं हुई तो। उस समय अल्ट्रासाउंड भी नहीं थे, उस समय एमआरआई भी नहीं था, उस समय टीवीएस भी नहीं था। अभी इतनी सारी इन्वेस्टिगेशंस का जिक्र हो रहा था, तो सब लोगों ने ये कहा कि ऐसी इन्वेस्टिगेशन होनी चाहिए। Richard, Dr. Shilpi will explain you each and everything. Do not worry about that. आप लोगों को ये एक बात मैं बहुत अच्छी तरह बता दूं कि ये जो एरा चल रहा है वो इन्वेस्टिगेशन का चल रहा है। आज हम लोग क्या करते हैं कि पेट में दर्द हुआ तो अल्ट्रासाउंड करा लिया, आज हमने बीपी हाई हुआ तो हमने लिपिड प्रोफाइल करा लिया, अब हम आज जरा सा डाउट हुआ तो डॉक्टर ने लिखा सीबीसी। पहले क्या होता था, डॉक्टर सीबीसी लिखता था तो सीबीसी चेक होता था। पहले डॉक्टर लिखता था सिर्फ हीमोग्लोबिन चेक होना तो हीमोग्लोबिन चेक होता था। आजकल लेबोरेटरीज पे आप सिर्फ सीबीसी लिख करके लेके जाओ, वो आपको बताएंगे नहीं 1500 रुपये में इतना पैकेज है, या वो एक अच्छा सा पैकेज है जिसमें आपके सारे टेस्ट कर देंगे। तो ये एरा जो है वो इन्वेस्टिगेशन का चल रहा है। और इसकी सबसे खराब बात ये है कि हम लोग जो फिजिकल सिम्टम्स हैं उसको क्लिनिकल मैचिंग के साथ मैच ही नहीं कर रहे हैं। अल्ट्रासाउंड ने कहा कि पीसीओडी है तो हमने सोच लिया पीसीओडी है। हमने अभी तक ये वेरीफाई नहीं किया कि यार वो जो सिम्टम्स आ रहे हैं कुछ और वजह से तो नहीं आ रहे हैं। क्या हिरोसिडेम सिर्फ पीसीओएस की वजह से आएगा? और भी तो हार्मोन्स हैं। तो ये जो एरा है ये बदलेगा जरूर। अब से 20 साल बाद 30 साल बाद हो सकता है कि सब लोग फिर से वही पल्स देखना शुरू करें, हो सकता है फिर से वैसे ही सब लोग सिम्टोमेटिक ट्रीटमेंट देना शुरू करें। इसीलिए होम्योपैथी का फ्यूचर है, बहुत अच्छा है। क्योंकि यहाँ पे यही है पूरी दुनिया में एक ऐसी पैथी है जो होम्योपैथी सिस्टम जो है वो मेंटल स्टेट को फिजिकल स्टेट के साथ कनेक्ट करके चलता है। इसके अलावा पूरी दुनिया में कोई सिम्टम नहीं है, कोई ऐसा सिस्टम है ही नहीं। तो मैं जो बताना चाह रहा हूँ कि पीसीओएस को कुछ ऐसी तरह समझो। आजकल आप देख रहे हो कि जो यंग गर्ल्स हैं उनमें मेंसेस को लेकर के एक बहुत बड़ा जो मिथ है ना वो पैदा हो गया है। बहुत सारी फीमेल्स हमारे पास आती हैं कि डॉक्टर साहब देखो मेरी मदर चाहती है कि इसको मेंसेस आए, लेकिन मैं तो एक्चुअली मैं चाहती ही नहीं कि मेंसेस आए। क्योंकि हर एक कि अगर आप पूरे साइकिल का काम देखो, मतलब अगर फीमेल बॉडी में मेंस्ट्रुएशन का काम है सिर्फ नेक्स्ट प्रोजेनी को जन्म देना। लेकिन अगर नेक्स्ट प्रोजेनी को कोई जन्म ही ना देना चाहे, वो ये सोचे कि नहीं मैं तो 30 साल में शादी होगी, 35 साल में बच्चे करेंगे, ये 45 साल में बच्चे करेंगे, तो एक्चुअली में ओवरी का रोल क्या रह जाएगा? तो एक दिन ऐसा आएगा कि हो सकता है आप लोगों ने देखा होगा या बहुत सारे लोग ऐसा जानते भी होंगे, जो एनिमल में मेंसेस होते हैं वो 6 महीने में 1 साल में होते हैं नॉर्मली। जो लोग एनिमल लवर्स हैं इस बात को जानते होंगे, जो नहीं जानते आपको बता दूं कि ज़्यादातर एनिमल्स में जो मेंसेस होते हैं वो 6 महीने पे 1 साल पे होते हैं। अब से हो सकता है 20 साल बाद 50 साल बाद जो यहाँ ह्यूमन फीमेल्स हैं वो भी शायद साल में एक ही बार साइकिल को लेकर के आए। क्योंकि हम लोग पीसीओडी पे इतना ज़्यादा काम कर रहे हैं, हमारे यहाँ पे लड़कियां आकर खुद कहती हैं कि सर देखो हमें तो कोई है नहीं, हम तो चाहते कि ना आए। क्यों एक फीमेल सिर्फ साइकिल तो साइकिल परेशान होती रहे? बहुत सारी ऐसी फीमेल्स हैं जो अपना ट्रीटमेंट कराने के लिए मना कर रही हैं, क्योंकि उनकी मदर्स हैं या उनकी जो सोशल फैक्टर्स हैं वो उनको एहसास दिलाते हैं नहीं यार मेंसेस नहीं आएंगे तो तुम ऐसे हो जाओगे। वरना हो सकता है कि ये एक इवोल्यूशन का प्रोसेस हो। तो ये भी एक ऐसी चीज़ें हैं जो आपको कंसिडर करके चलनी चाहिए अदर देन द पैथोलॉजिकल बुक्स। अगर आप पैथोलॉजी की बुक्स पढ़ोगे और लियोन स्प्रोफ की गार्निंग एंड ऑफ्स पढ़ोगे तो लियोन स्प्रोफ ने बहुत अच्छे से बहुत क्लियरली मेंशन किया है कि जो पीसीओएस है ये कोई डिजीज है ही नहीं किसी भी तरह से। आप देखोगे उसने सिर्फ पीसीओएस को लेकर के 30 से 40 पन्नों में एक अच्छा सा डाटा दिया है और उसने सब साइकोलॉजिकल पॉइंट्स को इंक्लूड किया है। बस कोई उसको पढ़ नहीं रहा है, कोई समझ ही नहीं रहा है। हम सिर्फ एक छोटी सी ओवरी को दोष दिए जा रहे हैं, अच्छा पीसीओएस हो गया पीसीओडी हो गया, उससे आगे भी तो कुछ है। तो वो जरूर देखो कि आखिर वो ओवरी बेचारी जो एक बिल्कुल शांत जगह पे बैठी थी, बस अल्ट्रासाउंड ने उसको खोज दिया तो आप सिर्फ ओवरी के पीछे लगे। ओवरी कहाँ से स्टिमुलेट होती है वो भी हमें जरूर देखना है। सो डॉक्टर शिल्पी, मैं चाहता हूँ कि डॉक्टर रिचर्ड क्योंकि वो बहुत मतलब मन से सुनना चाहते हैं तो आप प्लीज इनको जरूर बताएं।
Yeah, Dr. Richard, I'll just do a little translation, though not everything what he said I could translate, but the major content was that PCOS don't consider it as a single disease. It is something which is affecting the whole person as a whole thing. Nowadays, what has happened is that what could be the reason why the cases of infertility, why the cases of PCOS are increasing day by day. Not only in India, everywhere, all over the world, the cases of PCOS are on a very high verge. But basically, the only thing is why there are two major myths about PCOS. One is if you do the ultrasonography and see some kind of pathological changes in the ovary, it is termed as that it is PCOS. No one tries to actually find out whether the person is having PCOS or it is just a kind of a pathology you have got. Other thing is that nowadays there are it's something like Darwin's theory was there, and there were many other theories given. Use and disuse theory was there, that if you don't use any organ, it will go under dormancy. So basically what's happening nowadays is that we are having a wrong interpretation that if a person is having severe hair fall and slight ovary has a pathology, we will think it's hair fall is happening because of PCOS. But it's not always that we have to just concentrate on one or two things. We have to go deep inside the knowledge. We have to think a lot that what actually is the reason why ovary is not activated, why ovulation is not happening. So the real hidden reason we have to find out. And in majority of the cases of PCOS, we will find that there's a hidden either ignorance of the female on the level of if the family members are ignoring her, or her loved ones, her family members, her friends. If she has a ignorance, definitely some or the other way ovaries do get impacted. That is, there are few things which are not written in the theory in any books, but we have to understand that by our own experience. That is what he basically want to mean, and I might have forgotten few of the points.
नो, अगर आप इसको भूल गए हैं तो इसका मतलब वो जो बात है जो मैं समझाना चाह रहा था वो समझने में थोड़ा सा कमी लगी। मैं चाहता हूँ कि जितने भी मेरे यहाँ पे आज स्टूडेंट आए हैं और PCOS को जानने की कोशिश करना चाहते हैं, तो हम चाहते हैं कि इस कोर्स के जरिए, क्योंकि हमारा मेन मोटो था कि हम क्लिनिकल्स को अटैच करके हम होम्योपैथी के अप्रोच पे जाएं और हम ये बताएं कि अब ये जरूरी नहीं है कि आप सिर्फ मेंटल हिस्ट्रीज पे ही पेशेंट को ठीक करोगे, ये बहुत जरूरी नहीं है। आपको सिम्टम कंसीडर करने हैं, लेकिन उस सिम्टम को कैसे कंसीडर करना है। जैसे डॉक्टर श्वेता ने जब टोटलिटी ऑफ सिम्टम की बात की थी, तो आप ये समझो कि जब से मैं BHMS में हूँ और टोटलिटी ऑफ सिम्टम की बात की थी, तो हम सिर्फ टोटलिटी ऑफ सिम्टम बोले जाते थे, सिर्फ टोटलिटी ऑफ सिम्टम। लेकिन शायद 2014 में डॉक्टर श्वेता के एक लेक्चर से हमें पता लगा कि वो एग्जैक्ट जो टर्म है वो टोटलिटी ऑफ द सिम्टम है। तो जो सिर्फ एक दा का रोल है वही अपने आप में बहुत है। एफोरिज्म 7 में टोटलिटी ऑफ द सिम्टम का मतलब है, इसका बेसिक मीनिंग है कि एक जो सिम्टम है उसकी टोटलिटी बनानी है। हमें मल्टीपल सिम्टम्स की टोटलिटी नहीं बनानी है। हमें ये नहीं करना है कि अच्छा पेट में दर्द है, अच्छा सिर में दर्द है, अच्छा पैर में दर्द है, ये 3 हमने सिम्टम लेकर के रिपोर्टाइज कर लिए। हमें सबसे पहले जो पेन है, मतलब पेट में दर्द है, सबसे पहले इसकी टोटलिटी बनानी है, इसका सम अप करना है, फिर उसके बाद हेडेक का सम अप करना है, फिर उसके बाद पैर में दर्द का सम अप करना है। तो ये टोटलिटी का एक्चुअली मीनिंग है जो हमें डॉक्टर श्वेता से सीखने को मिला। ऐसे ही बहुत सारे डॉक्टर आशीष से मुझे मैथमेटिक्स सीखने को मिली, इस बार डॉक्टर मनीषा से पैथोलॉजी सीखने को मिली, यहाँ पे और भी कुछ हैं जो डॉक्टरों से मैं कुछ ना कुछ सीख रहा हूँ। तो हम लोगों की जो सबसे बड़ी प्रॉब्लम है वो है हम लोग शेयरिंग नहीं करते। मैं चाहता हूँ कि आप ऐसी शेयरिंग करो। मैं आपके साथ कनेक्टेड हूँ, डॉक्टर शानवी, डॉक्टर शिल्पी आपके साथ कनेक्टेड रहेंगी। आपको किसी भी तरीके की PCOD में या PCOS में कोई भी दिक्कत आती है, हम लोग यहाँ पे हैं, पूरी फैकल्टी हेल्प करेगी। आप ये कभी मत सोचिएगा कि हमने सिर्फ आपको एक कोर्स दिया है और हमने अपना काम पूरा कर दिया, ऐसा नहीं है। हम आपके साथ हमेशा से कनेक्टेड रहना चाहते हैं और हम एक साथ मिलकर के काम करना चाहते हैं। एक बात जो मेरे दिमाग में और है कि PCOS के सिम्टम्स ऐसे हैं, जो मेरा एक पॉइंट था कि PCOS में जरूरी नहीं है कि आपको सिर्फ PCOS के सिम्टम मिलेंगे। जैसे हम लोग एक ड्रीम एज इंडिकेटर्स पे काम कर रहे हैं, दैट वाज स्टार्टेड बाय डेबी ब्रक। डेबी ब्रक वाज द फाउंडर ऑफ होम्योपैथी वर्ल्ड कम्युनिटी। उन्होंने एक कंसेप्ट रखा, मतलब मैंने उनको एक स्टडी दी थी ड्रीम्स के ऊपर। तो हम जो यहाँ पर PCOS या PCOD में ऐसे केसेस में ज़्यादातर स्टडी कर रहे हैं ड्रीम ऑफ स्नेक को लेकर के, और हम पा रहे हैं कि जो ड्रीम्स ऑफ स्नेक हैं या ड्रीम ऑफ वाटर हैं, ये इतने ज़्यादा सीवियर हैं। और ऐसे केसेस में जहाँ पे PCOD या यूट्राइन फाइब्रॉइड्स आते हैं या फीमेल की जो जेनाइटल्स की पैथोलॉजी है वहाँ आती हैं, तो यहाँ पे ये 2 जो ड्रीम्स हैं ये बहुत ही सिग्निफिकेंट मिल रहे हैं। हमने जो स्टडी की है उसमें मोर देन 80% ये ड्रीम्स आ रहे हैं। मैं चाहता हूँ कि आप भी हमारी स्टडी का पार्ट बनिए। अगर आपके पास कोई ऐसा केस आता है जो PCOD या यूट्राइन फाइब्रोइड से कनेक्टेड है और आपको उस केस में किसी भी वजह से ड्रीम ऑफ स्नेक या ड्रीम ऑफ वाटर मिलता है, तो हमसे जरूर शेयर करिए। हम उसकी हो सकता है पर्टिकुलर आपको मेडिसिन बता पाएँ या किसी भी तरह से आपको हेल्प कर पाएँ। और हो सकता है अगर आपने हमें वो केस दिया या आपने हमें सिर्फ सिम्टम बताया कि हमें मिला, तो हम इसको एक रिकॉर्ड कर लेंगे कि हाँ ऐसे केसेस में आपकी एक रिकॉर्डिंग का नाम भी चला जाएगा। हम आपका केस नहीं लेंगे, हम आपका कोई चीज़ छीन नहीं रहे हैं, बस हम कंसिडर कर लेंगे कि हाँ 100 केस होकर के डॉक्टर मनीषा की तरफ से एक केस आया, डॉक्टर शानवी की तरफ से एक केस आया, डॉक्टर आयुषी सक्सेना की तरफ से एक केस आया, तो हमने बस अपने अंदर काउंटिंग कर लेंगे कि हाँ 100 की जगह 105 केस हो गए जहाँ पे पीसीओडी या यूट्राइन फाइब्रॉइड में सांपों के सपने या पानी के सपने दिखाई दिए। जी डॉक्टर, आपको फिर से एक बार हेल्प करनी पड़ेगी।
Fine. So the purpose of the course was not only to give little knowledge about PCOS. We other together. That is one thing which is I always found missing in homeopathy is we don't come together and do a work. We always stand on our own and try to do work individually. Though individualization is one of the motive of homeopathy, but individualization doesn't mean that the doctor should stand in individual. We all should come together and do something so that we can do upliftment of homeopathy, upliftment of the patients. So whatever cases of PCOS you all come across, if you're able to tell us, discuss about like how you were able to treat it, we'll be very happy. If in case you have some cases which you are not able to do the proper justice, discuss that also so that we together can find out the best remedy. If you're getting some kind of specific dream sequences, like as we mentioned in our many cases that there was a very strong history of dreams of some water, dreams of snake, dreams of falling, or some other kind of peculiar dreams. If you also come across with a symptom, similar kind of a symptom, do share with us so that we also can have a data that in these many cases we have got this history, so that every time everyone can be benefited. Next generation of ours who are becoming the new homeopaths, they also can get benefited. So the motive is to bring you all together so that we all can do something for the upliftment of homeopathy and betterment of the society. Okay. Anything else anyone has to say? Please kindly submit your feedback form. Definitely submit your questions, submit your answers, submit the answers for the puzzle. If there is any difficulty, please feel free to approach us. You have our numbers. You can contact us anytime.
डॉक्टर शिल्पी,
Yeah.
कल हम लोग एक कॉन्फ्रेंस में थे जहाँ पे डॉक्टर श्वेता का एक लेक्चर था पीसीओडी से रिलेटेड कुछ उसमें, तो उन्होंने एक बहुत नई बात बताई मेडिसिन की एडमिनिस्ट्रेशन को लेकर के। मुझे लगता है कि हमारे लिए सबसे मेन पॉइंट था, तो मैं चाहता हूँ डॉक्टर श्वेता सिंह इस एडमिनिस्ट्रेशन वाली बात को जरूर शेयर कर दें, क्योंकि एक ऐसा पॉइंट है जहाँ पे हमें मेडिसिन देने का जो तरीका है वो जरूर आना चाहिए।
Yeah, Dr. Shweta, can we listen to that special thing?
That administration of homeopathic medicine or the miasmatic medicines I have already shared in my PPT, sir. We should always give the anti-miasmatic treatment in morning empty stomach, not in the night hours or not before sleeping, so that we can avoid the homeopathic aggravation and the body in the morning because of the fasting. When we are sleeping, or it is our body is on fasting, so it will detox the whole body, and the medicine will act more efficiently in that case if we are giving it in morning hours. And the other thing you also told about the hormonal state got little suppressed during when we are sleeping or in the night hours, and they are more active in the morning hours. So our medicine will act more efficiently if you are giving it in the morning hours empty stomach. So this is the thing. And I have already told about the administration in cases of females, which should be done which should not be done during menses or just before the menses. It should be given after 4 days when your menses are set in. The anti-miasmatic treatment should always be given after the menses or on the 4th day. It should be avoided during the menstrual setup. And the thing is, if there is some menstrual problems going on, if there is any acute condition of menses, like prolonged menses, profuse menses is going on, then you should use acute remedies at that time, and reserve your anti-miasmatic remedy. Don't give at that time. After you handle the acute state with the acute remedies like anti-hemorrhagic remedy or anti-inflammatory remedies in homeopathic remedies, after the acute is managed, then only you should give that anti-miasmatic remedy or the chronic remedy. Thank you.
Thank you, Dr. Shweta.
थैंक यू। डॉक्टर शिल्पी, एक टिप और रह गई है, मुझे लगता है वो सबको जानी चाहिए। अगर आपके पास कोई भी केसेस हैं पीसीओडी के और आपको कोई स्पेसिफिक रेमेडी, मतलब या कोई भी जनरल रेमेडी या सिम्टम वाइज या मियाजमेटिक वाइज, कॉन्स्टिट्यूशन वाइज आपको कुछ भी समझ में नहीं आ रहा है, तो मैं इस पे काम कर रहा हूँ। अभी मैं इसको पब्लिश नहीं कर रहा हूँ, लेकिन फिर भी आप लोगों को एक चीज़ बता देता हूँ कि आप एक मेडिसिन है हाइपोथैलेमस 1 है, इसकी एक डोज यूज़ करिए, लेकिन इसकी जो स्पेसिफिक टाइमिंग्स हैं वो हैं 4 बजे से लेकर के 6 बजे तक सुबह में। हालांकि हमारे पेशेंट बहुत सारे परेशान हो जाते हैं कि इतनी सुबह कौन दवाई लेगा, लेकिन ये इसके स्पेसिफिक टाइम है। मैं जो डॉक्टर श्वेता से अभी समझना चाह रहा था, सुनना चाह रहा था, वो है टाइम को लेकर के कि हर एक रेमेडी का अपना एक टाइम है, उस टाइम पर ही रेमेडी जाएगी तभी ठीक होगा, वरना वो एग्रेवेशन करेगी। तो हाइपोथैलेमस 1M हम लोग इस पर अभी काम कर रहे हैं 3 साल से पीसीओएस में, ऐसे केसेस में जहाँ पर हमें कुछ और समझ में नहीं आ रहा है, लेकिन इसके स्पेसिफिक टाइमिंग है सुबह 4 बजे से लेकर के 6 बजे के बीच में ही कहीं डोज देनी है। हाइपोथैलेमस 1M ये बिल्कुल बहुत अच्छी चीज निकल के आएगी अभी कुछ दिनों बाद।
Thank you, Dr. Deepak, for this new information, which I never knew. Fine. I hope we should wind up the session now. It's gonna be 10:30, past 10:30 now. So thank you, everyone. And I hope you all enjoyed the sessions with us. Please do get back to us in whatever way you want to. You'll be getting your certificates very soon. And whatever your, if you have any other cases or anything, please feel free to talk to us and approach us. Fine. And I would like to thank from my bottom of my heart to all my faculty members who has made this course really a very good success. Thank you. Thank you, everyone.
Thank you.
Yeah. Thank you. Thank you, sir.
Bye, everyone. Good night.
Good night. Bye.
Good day, sir.
Bye-bye.